This is One on One. We are pleased to be joined by our good friend, Dr. Jeffrey R. Boscamp. He's got a detailed title. He's Vice President, Chief Academic Officer, Hackensack University Medical Center, and Physician-in-Chief, Joseph N. Sanzari Children's Hospital. Good to see you, Jeff.
Great to see you again, Steve. Always a pleasure.
Yeah, absolutely. I've also want to make everyone clear that I've talked about Hackensack before. I've done some physician leadership coaching and communication coaching up there as well, so I know a little bit about your operation. The medical school that's happening, Hackensack, Seton Hall, when's it happening? Why is it so important?
Well, it's already started happening, and fantastic project. I mean, we're all just energized and excited by it. I think the whole state is. Everybody's gotten really behind this new effort. First private medical school in New Jersey, a combination of two incredibly strong institutions, Seton Hall University, Hackensack University Medical Center, great education, superb clinical care at Hackensack, coming together to put this school together in an incredibly innovative way. And I know we've talked about it before in the past.
We've talked about it offline a lot.
Yeah, and there are tremendous opportunities here to teach in ways that have never been taught before.
Break that down a little bit, Doctor. When we have talked offline, one of the big subjects is communication.
Yes.
And doctor-patient, teaching physicians or future physicians a new way, a different way of doing what they do. Make that clear.
Yeah, I mean, we have an opportunity here with a brand new medical school to do things in a completely different way.
For example?
So, for instance, I mean, passively sitting in a lecture for an hour, forget it, we're not doing that. We're going to have students communicate with each other, have faculty that is not the so-called sage on the stage. We're going to have guides by the side. Let the students teach each other, learn to communicate, learn to teach.
Why? Why does that matter? How does that change anything about how care is delivered?
It changes everything because it's how you learn. What's happening is that the educational material you learn in medical school, by the time you're 5 years out, half of it's gone. So that's not the point. The point is to teach people how to be active learners, how to continue to learn, not just when they're students, but when they're residents, when they're physicians out in practice. You got to continue that learning process. We're going to give people the skills to be able to pick that up themselves and to be able to teach. Those students will become residents, will become attending. They're going to be then teaching. So the process just continues. And there just hasn't been an emphasis on that. When you sit in a lecture and you're just told what you need to memorize, that's not going to be lifelong learning. It's not going to create the kind of learning that we want. So we have an opportunity with a brand new school, a complete tabula rasa, blank slate, to say, let's do it differently. Let's engage the students with clinical material that's relevant to what they're going to do from day one. There used to be this 2+2 model, so that 2 years you'd sit in a lecture hall, you'd memorize cycles, you'd get all this basis, and then the great day would arrive, you could actually see a patient. We're going to have students involved as navigators for patients, for doing things, seeing cases, understanding why they're learning something. That's what sticks.
That's different.
It is different.
But I'm curious about something. You've been involved in medical education for a long time. You've seen it evolve. Why is it coming to this now?
I think, you know, first of all, there's an explosion of knowledge. And we have an opportunity with the doctor shortage. And for us, for Seton Hall and Hackensack, in New Jersey, we're facing a 2,500 physician shortage by the year 2025. We know that if you train physicians in a state, they're going to likely stay in that state.
So we won't lose them.
That's right, because there's been a drain from New Jersey. We've actually lost a lot of really great students and residents that have trained elsewhere, and then they tend to stay in that place. We need them here. We need the great brains and minds to take care of our, of our patients here in the state.
When is the school open?
Well, we got a lot of work to do. There's this thing called the LCME, which is the Liaison Committee on Medical Education. They're the ones that give us the green flag to go start the school. So between now and the end of the year, we've got a lot of work to do to get accredited. We just brought in our first dean, our founding dean, Bonnie Stanton, is a great leader, a great academic who's giving us the direction we need now to go down this road. First class, everything goes well, be sitting at the Seton Hall Hackensack School of Medicine, fall of 2018.
It's exciting for you, isn't it?
It's very exciting. I mean, it's exciting for the whole organization because, Hackensack gives incredibly excellent care. But to do that elevation to the next level, to be a true academic medical center, to have your own residents, to have your own students, that is game-changing for all of us.
But Jeff, before I let you out of here, I'm curious, will it take a different kind of person to be a physician of tomorrow, or will you just take the same kind of people and teach them differently?
No, I think it's going to be a different person, and how we select those people is going to be.
So the criteria is different.
The criteria is going to be different.
Dare I use the term? Sorry for interrupting. Emotional intelligence.
Absolutely. There's
a
lot of discussion of that. Is how, what's happening now, what we intend to do is you don't just write an essay and look at your MCAT scores and your college GPA and say, that person's here, that person's here. Multiple mini interviews. Don't know if you've heard the process. Bang, 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 meeting multiple people. See how you think. See if you're empathetic. See if you could relate to patients. Can you communicate in a reasonable way? Those are going to be the skills that are going to be valued. The mission of this school is going to be to deliver care to disadvantaged and disenfranchised people. And we want to create people and doctors in that setting that will do that, will go out there and understand what people need.
Real quick, before I let you out of here, we know a little bit about the folks up at Bergen Community College. They just opened up a new health center. Tell us about it real quick.
Yeah, so their health professions teaching center is their first new building in quite some time. They're very excited about it. We at Hackensack, a lot of our employees get trained there. A lot of our employees come from there. So they're turning out a lot of people in different health professions that are able to help meet the need of the community. And this new teaching center, which is beautiful, will really help them become a center. It's going to be incredible.
The medical profession continues to change. The physicians of tomorrow, and there is a shortage, is evolving, and Dr. Jeffrey Boscamp is on the cutting edge of that effort. Dr. Jeffrey Boscamp, Vice President, Chief Academic Officer, Hackensack University Medical Center, and Physician-in-Chief, Joseph M. Sanzari Children's Hospital. Good to see you, buddy.
Great to see you, Steve.
Stay there. We'll be right back, right after this.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Investors Bank, the New Jersey Education Association, Verizon, Qualcare Inc., Johnson & Johnson, ShopRite Supermarkets, and by the New Jersey Office of the Insurance Fraud Prosecutor. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.